Hello, welcome back. So, we are going through the fetal period, and now we are coming up to our fourth session, which is the time of birth and what are changes in the occurring. I hope you are really enjoying the lecture. So, what we'll be discussing in this session that what is the premature and post-mature born babies, what are when do you call them they're premature, what is the length of a normal pregnancy, and when do you call them post-mature, and how do you assess through the ultrasound. As in the previous sessions, I was constantly discussing about the crown rump length, about the measurements of weight and age at weeks. So these are all correlated. At certain age, there should be a certain height as well as a certain weight of the baby. If there is not corresponding with the normal values, either this baby is small for gestational age or there is intrauterine growth retardation. So in this, we will be going through that period. The date of the birth is most accurately indicated at 266 days or 38 weeks after fertilization. Now there is a problem over here. At sometimes the cycle is not regular. At times a female is not sure when she was fertilizing, because the fertilization when it does occur, although there's an increase in menstrual there's increase in the called as body temperature. There are certain signs which tell you that she may be overloading at this time, but to be exactly pinpoint that when the fertilization occur is really very tough. So the idea is, instead of calculating the 266 days or 38 weeks from fertilization and when actually the fertilization took place, we calculated from the time he missed her last period. That is, the oocyte is usually fertilized within the 12 hours of ovulation. However, sperm deposited in the reproductive up to 6 days prior to the ovulation can survive to fertilize oocytes. So exactly fertilization you don't know. When there are certain signs of the body of the female body that she may be experiencing ovulation at that time. But whether fertilization has occurred or not, you're not sure about it. And if it has occurred, at what time it has occurred, we are not sure about that either. So the best guess is, instead of making a guess and making a false calculation, the best guess is that she is always sure that when did she had the last period, when the last period stopped. So the obstetricians calculate right from that day. And instead of calculating it from fertilization, they add 2 weeks to the previous date. So what results is they calculate the date of birth as 280 days or 40 weeks from the first day of the last normal menstrual period. In women with regular 28-day menstrual cycle, the method is fairly accurate. But when cycles are irregular, substantial miscalculations can be made. Now, this is a problem is that last menstrual cycle, usually in a normal 20-day cycle, she would be, the last normal menstrual cycle would be 14 days prior to ovulation. But if her cycle is irregular or her cycle is such that she normally is from 21 days to 32 days, and sometimes can be prolonged as up to 2 months. So you're not sure whether exactly she was fertilization has been done 2 weeks prior to the last normal menstrual cycle or 1 month prior to the last normal menstrual cycle. So there is a confusion. Although in a normal cycle, it's very fairly accurate method that you calculate the last normal menstrual cycle and add 40 weeks to that, and you can calculate the expected date of delivery. So when do we call them premature and post-mature born? Normally, it's 40 weeks, but it's not exactly. The range is from 38 till 42 or 37 till 42 at times. So even up till 42, they can be calculated as the normally born. But if they're born before that, the certain time, they're called as premature, and if they're born after 42 weeks, they're called as post-mature. Most fetuses are born within 10 to 14 days of the calculated delivery date. Now 10 to 14 days means you can easily add plus minus 2 weeks. If they're born much earlier, they're categorized as premature, and if they're born later, they're considered as post-mature. By combining data on the onset of last menstrual period with the fetal length, weight, and other morphological characteristics typical for a given month of the development, a reasonable estimate of the age of the fetus can be formulated. So what actually happens is, if the cycle was regular, very well. We know what was the last normal menstrual period. We know what was the time, and then we can calculate up to 280 days. But what if the cycle was irregular and she or the female and the mother has no idea when did the last normal menstrual period took place. So then how we can calculate what is the age of the fetus? Then those calculations actually come into play, that you do an ultrasound and you measure the crown lump length. And measuring the crown lump length and the weight and all that, the volumetric assessments, you can fairly calculate that, okay, at this, with this crown lump length and this weight, most likely this fetus is at this weeks of gestation. And then you can calculate, okay, most likely the last menstrual period was at this point of time. So this is exactly what I was talking about, assessment through ultrasound. It's a valuable tool for assisting in determination, which can provide an accurate 1 to 2 days measuring of the crown lump length during 7 to 14th week. Now there is always a variation, and the reason is that this intra-observer variability, that I can ping that point somewhere here and other would ping a millimeter above or below. That would change the length to some, and then actually this variation would result in either the age of the fetus would come a little higher, the value would come a little lower. Measurements commonly used in 16th to 30th weeks are biparietal diameter, which is the head circumference, head and abdominal circumference, and femur length. Now these are different measurements, which why they are used actually is because the head is growing differently, body is growing differently. So femur length would tell whether the body is growing at a good pace or not, and biparietal diameter head circumference will tell that either the head of the baby is growing normally or not. An accurate determination of fetal size and age is important for managing pregnancy, especially if the mother has a small pelvis or if the baby is a birth defect. Now, we have a anomaly scan at 20 weeks, and an anomaly scan is actually done to rule out different chromosomal abnormalities such as Down syndromes, and there is any knuckle translucency or not, and to know the gender of the baby as well. And especially if there is a low birth canal, has a very small volume, there's not enough space for the baby to come out, and then these all calculations become mighty important, because then we need to understand that fetus is large for the size or small for the size, or would it be able to come out of the birth canal or not. So I have discussed in my fourth session that what are the premature births which occur before the 7 month, what are the post-mature which occur at the after the 42 weeks, which is almost your 9.5 months after. And then how we can use an ultrasound to assess different things. For example, we can use ultrasound to make crown lump length, the biparietal diameter, head and abdominal circumference, femur length, and these can all be used to assess the age of the fetus and to assess how the fetus is actually growing, whether it is small for age or large for age, and how it is shaping it up eventually. For the fifth and last session, keep watching sqadia.com.